I'm Callista Cunningham.
And I'm Haley Waite.
I'm Tess Silzer.
And I'm William Fuller, and we are second year psychiatric nursing students. And in this presentation, we're going to talk about anxiety and depression in adolescents, and as well as some treatments and some interventions for dealing with anxiety. Okay, so this presentation is going to go over several points. I'm going to start off by talking about cultural safety a bit and what that means and why it's so important in healthcare. Then we're going to talk about anxiety and some of the causes of anxiety and treatments of anxiety. We're also going to talk about different kinds of anxiety disorders. We're going to talk about depression, the cause of depression and various types of depression, as well as the treatment of depression. And then we're going to talk about suicide and self-harm behaviors. And then finally, to conclude, we're going to talk about some resources that you can use if you require assistance or if you're struggling. And then there's also a survey component too at the very end. Okay, so I'm gonna just start off this presentation by talking about cultural safety because it's so important in healthcare and it's a big part of our program. So cultural safety is all about respecting the ethnic background of individuals, groups, and communities. What's really important here is that cultural safety is different than equality, and that might sound kind of weird, but if you just treat everybody the same, that can cause problems, and it can cause your worldview to be forced onto that person. So a good example of this in healthcare, say you're working as a nurse on a unit and there's a patient whose religion requires them to pray at a certain time each day, but that interferes with your medication administration schedule. You can work with that person to ensure that they still get their meds and that they're still able to stick to their schedule with praying. So that's a pretty simple example. Cultural safety can get pretty complex, but it's just all about asking the person what their preferences are and respecting their traditions and respecting that they are different than you. So in order to be culturally safe, differences need to be respected and acknowledged, not ignored. You can't just ignore it and just say, I'm going to just treat everybody the same, because you can't treat everybody the same, because not everybody is the same. Everybody is different in their own way, and that includes their culture and their traditions. So cultural safety is part of the standards of practice and the codes of ethics of regulatory bodies and professional associations in Canada. And at Saskatchewan Polytechnic in psychiatric nursing, cultural safety is one of the arenas of practice for our clinicals. So it's pretty important to get right. And in this presentation, you're gonna hear about lots of different treatments and interventions for various mental health issues. And it's important to know that as we talk about that, that no one patient is the same, and that those interventions might not work for the same patient. So you might have to adjust what you do depending on who the patient is.
So the first thing that we're going to talk about is anxiety, and we're going to talk about what is anxiety. So anxiety is a common human emotion and can be a healthy, normal response to a stressor. For example, that anxiety that you feel before taking a test, that's very normal and healthy, and a lot of people experience it. But anxiety becomes a disorder when it chronically interferes with one's ability to function. Individuals who struggle with anxiety typically show physical symptoms such as muscle pain, blurred vision, tachycardia, which is like an increased heart rate, dyspnea, which is troubled breathing, difficulty swallowing, loss of appetite, increased sweating, and decreased libido. So next we're going to talk about the cause of anxiety. Etiology is also another term for cause. The exact cause of anxiety disorders are not fully understood, and there are many psychosocial and biological theories to explain it. Genetic vulnerability is one of them. A person may have a biological predisposition to develop a disorder when certain environmental factors are present. And on the next slide, we're going to talk about a few risk factors for developing an anxiety disorder. So trauma is one of the risk factors. Children who encountered abuse or witnessed trauma have a higher chance of developing an anxiety disorder at some point in their life. Stress due to an illness is another one. Having a chronic or serious illness can cause immense worry, leading to an anxiety disorder. Events can also trigger anxiety disorders. So, a significant life event, such as death in the family or loss of a job, can lead to a diagnosis of an anxiety disorder. Personality is another huge one. Some individuals with certain personality traits are more prone to anxiety. So, for example, like people who have a type A personality, really like organization and stuff like that, that can kind of bring out anxiety disorders. Um, Diagnosis of another mental health disorder is a huge one. People with depression, for example, have a much higher chance of also being diagnosed with an anxiety disorder. Genetics, individuals who have a family with mental health diagnoses can increase the risk for developing an anxiety disorder. So if your mom, for example, was diagnosed with a mental health disorder or anxiety when she was in her 20s or 30s, you as an adolescent might have an increased risk. And drugs and alcohol is another one. Drug and alcohol abuse and withdrawals from those substances can exacerbate signs and symptoms of anxiety. So there's multiple different types of anxiety disorders. The first one is social phobia and social anxiety disorder, which is also known as SAD. Panic attacks and disorders, generalized anxiety disorder, and obsessive compulsive disorder. So first we're going to talk about social phobia and social anxiety disorder. Social phobia is a type of phobia characterized by a fear of being negatively judged by others or a fear of being publicly embarrassed. Social phobia and SAD can present themselves with feelings of stage fright, fear of intimacy, and fear of humiliation. Individuals with these disorders often have trouble speaking in classes, reading out loud, having conversations with people that they don't really know, and attending parties or social gatherings. Although they present similarly, social phobia and SAD are different. Teenagers with social phobias typically feel better when they're removed from the actual social situation, whereas an individual with SAD struggles a majority of their time with their social phobia. So the next one that we're going to talk about are panic attacks and panic disorders. Panic disorders are characterized by sudden, intense, and unprovoked feelings of terror and dread. During a panic attack, an individual has a sudden and overwhelming feeling of impending doom that they're going to die. Panic attacks can occur after frightening experiences, prolonged stress, or just spontaneously. Panic attacks can also have physical body symptoms, including palpitations, dizziness, chest pain, shortness of breath, sweating, and a feeling of choking. And most individuals will have one panic attack in their lifetime, but when it becomes a reoccurring chronic thing, that's when a panic disorder becomes diagnosed. So next we're going to talk about generalized anxiety disorder. This one might be one that you've heard of. It's a chronic condition characterized by excessive and long-lasting anxiety and worry about non-specific events and situations. Individuals with generalized anxiety disorder excessively worry and feel afraid of many things, including money, health, family, work, and school. These individuals lack an ability to identify their specific fear and control their worry. Signs and symptoms of generalized anxiety disorder often include continuous or episodic worrying, worry over minor everyday occurrences, difficulty worrying, irritability, muscle tension, difficulty concentrating, and restlessness. People who struggle with generalized anxiety disorder often expect failure and disaster to happen to the point that it interferes with their activities of daily functioning, such as school, work, social activities, and their relationships. And those struggling often have a persistent fear that something bad is going to happen, and it holds them back from a lot of the multiple tasks throughout their day that they try and do, such as school or homework or attending social get-togethers, and often it interferes with the concentration of daily tasks as well. And we're also going to talk about obsessive compulsive disorder, OCD, which is a type of anxiety disorder. So OCD is an anxiety disorder that is characterized by intrusive thoughts and actions that are repetitive and distressing. Individuals with OCD often know that their compulsions are unreasonable, but they're necessary to do to relieve that individual's anxiety. People with OCD may even be private about their thoughts and behaviors because they may view them as strange and out of the ordinary. Even individuals with OCD know that the behaviors that they're taking part in may seem weird or they're not necessary, but to relieve that inner anxiety, they have to act on them. So a few OCD rituals may include cleaning personal items often, cleaning their hands often, constantly checking clocks, and constantly flicking light switches, and there's many more. Each individual has their own set of rituals. So now we're going to move on and talk about the treatment of anxiety disorders. There's a few different types of treatment, and it really depends on the person. To start off with, there's pharmacological treatment, and that is treatment of a disorder with the use of medication. So common medications of choice for anxiety include selective serotonin reuptake inhibitors, which are also known as SSRIs, and then selective norepinephrine reuptake inhibitors, which are known as SNRIs. And they're also common in treating depression, but they can be very helpful for treating anxiety as well. Psychotherapy is another one, which is also known as talk therapy or counseling. It's an effective way to eliminate and control troubling symptoms of anxiety so an individual can better function and increase their overall well-being. Psychotherapists provide a mixture of support and insight-oriented interventions for their clients. And lastly is cognitive behavioral therapy, which is also known as CBT, and it's a very highly used technique when treating anxiety disorders. The overall focus of CBT is on thought processes and belief systems. So it helps individuals to learn and identify their problematic thought patterns, which are often unrealistic, and replace them with more realistic views on life. So these are more so interventions for anxiety. So these are things that if you feel you're struggling with anxiety, you can do these by yourself and they might help relieve some of those anxiety symptoms. So the first one is self-monitoring and symptom diary. This intervention includes monitoring the occurrence of anxiety disorders and identifying the anxious thoughts. Doing this frequently can aid in self-awareness and to triggers. Abdominal breathing is another one. When people are feeling anxious, they typically take rapid and shallow breaths, and that can actually decrease the oxygen to the brain, causing increased feelings of anxiety. So performing deep breaths down in your stomach, it's an effective way to decrease anxiety. Another one is progressive muscle relaxation. It's a tension reducing technique that involves relaxation of specific muscle groups. It starts with relaxing the facial muscles, then progressing to the next group of muscles, such as the neck and shoulders, and then so on until every area of your body has been relaxed. This can be a really helpful one with people that are struggling with nighttime anxiety. So like laying in bed and doing this often can relieve that anxiety and help them fall asleep at night. Exercise is also a very effective coping mechanism. Studies have shown that regular exercise of at least 20 or 30 minutes per day can reduce anxiety. Soothing music has also been shown to produce a hypometabolic response that can internally cause relaxation. And dietary changes have also been effective in reducing anxiety. So creating a well-balanced diet and reducing caffeine intake can reduce feelings of panic anxiety. And another intervention is called guided imagery. So guided imagery is a mind-body exercise that prompts individuals to create meaningful mental pictures for relaxation and reduced anxiety. So I have a little example here. This is just a short one, but it kind of gives you an idea of what guided imagery is and how it can help. So position yourself as comfortably as you can, shifting your weight so that you're allowing your body to be fully supported by your chair or couch. Take a deep, full, cleansing breath, inhaling as fully as you can, breathing deep into your stomach if you can, and breathing all the way out. Imagine a place where you feel safe and peaceful, either a place that is real or make believe. So, people that use this technique often go and create the same image every single time, and it's known to help after you practice it quite a few times. That image that you create in your mind becomes a safe place and can cause relaxation.
Okay, now we're just going to show a short video on 4 habits of anxiety.
Hey Psych2Goers, welcome back to our channel. Before we begin, we would like to let you know that your ongoing support has helped us make psychology and mental health more accessible to everyone. And that's amazing, so thank you. Now let's dive in. Anxiety is a debilitating mental illness, and it can have far-reaching effects on your day-to-day life. Symptoms of anxiety can be both serious and more subtle. Since anxiety kicks up so much worry and fear, you may have started to adopt new behavioral patterns to try and lower your feelings of anxiety. You might also be holding on to these created habits even though your anxiety has passed. For example, you may always automatically check where the exits are in a room whenever you enter. You always had to know where the nearest exit was in case you needed to escape during a panic attack. Anxiety can leave a lasting impression on your everyday habits because it affects your life so heavily. So, let's talk about 5 habits you may develop because of anxiety. Number 1, avoiding eye contact. Do you often avoid looking at someone in the eye because of your anxiety? Do you have a habit of staring at the person's forehead while conversing with them to avoid eye contact? It can be very difficult for you to look in the other's eyes while you speak, especially when you're feeling stressed or in a situation that brings out your anxiety. Looking someone straight in the eye can be very daunting, as there's no place to hide, and it can be a big trigger. Number 2, grinding your teeth. Do you have a habit of grinding your teeth at night? When you sleep, your muscles should relax and your body will lose tension. But when you're anxious, your body retains that tension. Grinding your teeth is a byproduct of anxiety or stress and can quickly turn habitual. Teeth grinding can also cause some serious damage to your teeth and jaw and cause tension-type headaches and severe facial or jaw pain. Number 3, waking up at intervals throughout the night. Do you have a lot on your mind? Is it difficult for you to sleep through the night? When you're going through a rough patch of anxiety, you might even wake up every couple of hours throughout the night. Your brain just won't turn off long enough to fully go to sleep. And because this became a repeated pattern, it's a difficult habit to break. Insomnia can be managed with the right strategies in place. If you reduce your anxiety and stress during the day, maybe through mindful meditation or yoga, that betters your chances of getting some relief at night. Number 5, chewing your lip. Do you find yourself pulling at skin on your lips or chewing on your bottom lip, or sometimes making the inside of your cheek bleed? You might be doing this when you're experiencing intense anxiety and have too much nervous energy with no outlet for it. Biting your lip is extremely common with anxiety, but it can become excessive and have harmful effects when it causes dry, chapped, and bleeding lips. Chewing on your lips is a coping strategy for your nervousness, similar to when you bounce your leg or bite your nails. Have you developed any of these habits due to anxiety? How did they impact you? What other habits did you develop because of your anxiety? Let us know your experiences in the comments below. We'd love to hear from you. Please like and share this video if it helped you and you think it could help someone else too.
All right, so I'm going to talk a bit about depression. So what is depression? Fluctuations in mood can be completely normal, especially during times of loss, change, and other stressors in your life. Depression, however, is a mood disorder that involves a persistent and chronic low mood. Depression can influence an individual's thoughts, emotions, and behaviors, and there is more than one type of depression. So the etiology of depression, or what causes depression. Depression can be caused by biological and environmental factors. Symptoms of depression can be caused by an imbalance of neurotransmitters in the brain, such as serotonin and norepinephrine. So serotonin is an important regulator of sleep and appetite. A decrease in serotonin levels can cause a decrease in appetite and cause changes to our sleep patterns. And norepinephrine affects attention. And so a decrease in norepinephrine can lead to difficulties in concentration. Stressful life experiences can trigger neurochemical changes in the brain, which alter these neurotransmitter levels. And then a family history of depression can increase an individual's chance of developing depression. So types of depression. So there's two types of depression that we'll be talking about today: major depressive disorder, or MDD, and then persistent depressive disorder, that's also known as dysthymia. So to start, major depressive disorder, or MDD, involves a change in normal daily functioning with signs of a depressed mood or decreased interest and pleasure in normal daily activities. Changes in mood must last most of the day for more than 2 weeks for a diagnosis to be made of major depressive disorder. And some additional symptoms that might be included with major depressive disorder include changes in sleep, appetite, energy level, and concentration, feelings of hopelessness or guilt, and agitation or irritability. And then persistent depressive disorder, which is also known as dysthymia. Dysthymia is a chronic form of depression in which symptoms of a depressed or irritable mood last for at least 1 whole year in adolescence and 2 years in adulthood. Symptoms of dysthymia are less severe than in major depressive disorder, but they still cause distress or impairment in normal daily functioning. And some additional symptoms of dysthymia might include insomnia, or difficulty falling asleep or staying asleep, or hypersomnia, which is excessive sleepiness. There might be changes in weight or appetite, poor self-esteem, and difficulty with concentration. All right, so treatment of depression. Pharmacotherapy can be a useful treatment for depression. Pharmacotherapy is using medications for treatment. So medications that are used to treat depression include antidepressants and mood stabilizers, such as selective serotonin reuptake inhibitors, or SSRIs, selective norepinephrine reuptake inhibitors, or SNRIs, and tricyclic antidepressants. Psychotherapy, or talk therapy, is also a useful treatment for depression. Cognitive behavioral therapy, or CBT, is a form of talk therapy that helps individuals to change their thoughts and behavior in order to then improve their overall feelings. All right, some interventions for depression. So exercise has been shown to be a great way to improve overall mood. And you can improve it by adding a mindfulness element, like focusing on how your body feels when you're exercising, or focusing on your breathing while you're exercising. Going outside and enjoying some sunlight can help with depression as well. So sunlight helps to boost serotonin levels, which helps you then improve your overall mood. You can challenge your negative thoughts, and that really helps with depression as well. So just asking yourself, how true is this thought? Is this a realistic thought? Can help to shift your perspective into a more helpful way of thinking. Practicing self-care and doing things that make you feel good can help with depression. Practicing relaxation techniques like deep breathing and progressive muscle relaxation can help to relieve symptoms of depression, reduce stress, and improve your overall feelings of well-being. And then if you need help, obviously seeking out help is a good option for depression as well.
Okay, now we're just going to show a video on the 5 signs of depression.
It's Michael's lowest prices of the season sale. Get 60% off maker faves like frames, canvas, and more. Plus, get 50% off all stems. Shop now through Thursday and get it today with curbside.
Do you feel like you just can't get happy? Are you finding you're pulling away from friends? Do you sometimes sit in your room in the dark, not even realizing how many hours have passed? Depression can affect anyone, especially teens. About 20% of all teens experience depression before they reach adulthood. That's a worrying statistic. When singer Will Smith's daughter, came out and said she suffered with depression, the comments at the bottom of many articles were attacking her, saying, "What have you got to be depressed about?" A lot of people don't understand that mental illnesses don't discriminate between age or circumstance. Often, depression is even more difficult to recognize in young people than adults. Because as a teen, you experience so many changes at this stage in your life. But the longer you feel this way, the more likely it's going to disrupt your life and turn into a long term problem. So, Psych2Go shares with you 5 ways to recognize depression. 1. Continuous low mood or sadness. Do you often feel very sad and low for a prolonged period of time? If you're feeling this way, things that normally lift your mood won't bring the same joy and happiness. You may feel low or cry for no specific reason. It's a good time to reach out and talk to someone. 2. Being irritable or intolerant of others. Irritability can be missed as a symptom of depression, as you're often stereotyped as moody and irritable already. It's also a very common symptom of depression. Often you'll have a very short temper and snap at people you love for no apparent reason. If you notice a change in your mood, it might be best to discuss it with someone, a parent, a school counselor, doctor, or a friend. Even if you think you're just having a rough time at school, it might not be depression, but talking it out helps to get the whole picture. 3. Showing feelings of helplessness. If you're suffering with depression, you'll feel out of depth, like you aren't in control of your life. You can feel completely helpless and confused. While these feelings are normal as you go through changes in your body and growing up, be aware if this symptom persists for longer than a few weeks. Feelings of unhappiness, worry, guilt, being fearful, helpless, hopeless, or lonely could all be signifying that something more serious is wrong. 4. Increasing social isolation. Do you want to just be left alone? When you're not feeling like yourself and your mood is low, it can lead to social isolation. It can be hard being around people because you feel like you have to act like you normally would. This emotional strain can cause you to give up socializing altogether. If you notice you're starting to withdraw from people, talk to someone. Even if you feel you're just having difficulties with friends, it may not always be a sign of depression, but dealing with it now can help stop it turning into something more. 5. Little to no enjoyment of things you once liked. Have you lost interest in being involved in after school clubs, music practice, or sports? Do you feel like you don't want to go and are contemplating dropping out? You might not even watch your favorite TV shows with as much interest. Not enjoying things you once liked could be a sign you're depressed. Have you struggled with depression? What do you do to help? Psych2Go would love to.
All right, so why is this important and why are we giving you guys this information today? We know that anxiety disorders affect 1 in 3 adolescents. And we also know that half of all lifetime cases of mental illness first emerge in adolescence. Additionally, there is typically a long delay between when an individual first experiences symptoms of a mental illness and when they seek or receive out treatment. So having an understanding of the signs and symptoms of anxiety disorders and depression can help to shorten that gap in receiving help.
So now we're going to talk about self-harm behaviors, and self-harm is defined as the purposeful destruction of body tissue without suicidal intent. Self-harm or self-injury usually develops a way of coping with difficult situations or feelings. Most of the self-inflicted injuries can be minor or more serious. They will generally be non-life threatening. Self harm can sometimes be called non suicidal self injury because it is not an attempt to commit suicide. A minimum of 15% of adolescents engage in self injury at least once. And some risk factors for self harm. Most common factors of self injurious behaviors are frequent negative emotions, difficulty expressing emotions, parental divorce, past history of sexual or physical abuse, and family members who suffer with substance abuse or mental illness. And some signs of self harm: changes in usual behavior, such as withdrawing from friends and peers, overdressing. An example would be wearing long sleeves and pants in hot weather, cuts, bruising, or burns that cannot be explained and appear to happen more than once. And some treatments and supports. Professional help is often needed, such as counseling or talks therapy, usually cognitive behavior therapy or dialectal behavior therapy. Counseling may be done one on one or in small groups. And how to support a loved one or friend: be supportive, don't judge them, help them to get medical help, and learn what you can about self harming and share that helpful information with your friends or loved ones.
Okay, so now I'm going to talk about suicide. Um, Suicide is similar to self-harm, but it's also different, obviously, with suicide. That's the ending of somebody's life. Um, there are many there are many reasons why somebody would want to choose to end their life, but the main reason is severe depression. Um, there's also bipolar disorder and other mental health issues and stress that can cause somebody to take their life, but really the main one is depression. Um, Also, some experiencing some kind of trauma, such as rape or abuse, or say a soldier in war, that can also increase the likelihood of suicide. Um, and 22% of rape victims will attempt suicide sometime in their lifetime. So even if somebody was the victim of a sexual assault, say 20 years ago, if they don't deal with that, they're still at just as much of a risk of ending their life. Um, a less common reason, but still pretty important, as to why somebody would end their life is because they're facing a loss or they're afraid of a loss. So an example of this is stress that's caused by school. Um, there have been cases at certain uh, universities where students, just because they're under a lot of pressure from their parents to succeed, or they're under a lot of pressure to succeed in their classes and do well in their program, they can't take it anymore, so they end up jumping off somewhere high, or they take their life in some other way. So that does happen at universities with people who are experiencing too much stress. So that's just speaks to why it's really important, if you're in that situation, to really seek help. Your life is what's most important. Okay, so now I'm going to talk about suicide in Canada. So really, suicide in Canada disproportionately affects Indigenous people. Um, Suicide rates among Indigenous people are 3 times higher than for non-Indigenous people, but for Indigenous youth, it's actually 5 to 6 times higher than for non-Indigenous youth. So that's pretty significant. There's um, there's a number of reasons for this high level, um, but probably the top reason is the legacy of residential schools. So I hope you guys have learned or will learn about residential schools, but really the important thing to know there is that residential schools in Canada, they operated for decades, and they caused a lot of trauma for Indigenous people, and quite often that trauma has not been dealt with. So what happens is then it gets passed on from generation to generation, um, and suicide can occur generations down the road from trauma that happened like way in the past. So it's pretty significant when it's not dealt with. And another thing to note is that residential schools cause cultural disruption. So and so say a young man might be contemplating suicide. He might not, because his culture has been taken from him or disrupted. He might not have the resources or the tools to speak to an elder or somebody from his culture who can help him. So that's pretty major too. Um, Suicide is right here in this province. Suicide is the leading cause of death in northern Saskatchewan for individuals aged 10 to 49. So that is just crazy to me. Um, the north is has a high First Nations population, and it's also very sparsely populated too. So that just compounds the issue. It just makes it really hard to seek help, and there's not a lot of resources up there. So it's a crisis, quite honestly. Um, and another point here, suicide, just in general for everybody, suicide is the second leading cause of death for youth aged 10 to 19. So again, it's just a very big issue. And if you know somebody who's contemplating ending their life, it's just really important to reach out to them and really important to get that support as well. Okay, so this is a bit of a chart here that really breaks down the difference between self-harm and suicide. So with self-harm, the frequency is different. It takes place a lot more often. It's a lot more frequent. Suicide happens less frequently. In terms of the methods, self-harm is just injuring yourself. It's causing damage to your body without the intent of wanting to end your life. And with suicide, you're actually trying to end your life. So it's more lethal. Um, Self-harm obviously is less severe than suicide, but uh, than suicide. Purpose of self-harm is done to avoid suicidal impulses. So it's meant sort of as a coping mechanism, actually, to just really avoid eventually trying to take your own life. So again, with suicide and self-harm, the key here is that with self-harm, there is no intention of killing yourself. So that's really the main difference to remember in this case. However, if left untreated, self-harm can lead to suicide. So if somebody has been hurting themselves for months or even years, um, just the chances that they're going to eventually attempt suicide just keep going up. So that again speaks to the importance that if you know somebody who's doing self-harm, to really reach out and help them, because it can get worse and it will get worse without treatment. Okay, now I'm going to talk about some resources. So the first one I'm going to discuss here is the Canada Suicide Prevention Service. I've posted the number for that and the numbers for the other resources I'm going to talk about. So that's a number that you can call 24/7 and talk to somebody. Second one is the Kids Help Phone. So the Kids Help Phone is an organization that's been around for over 30 years. They are a charitable organization, and that's their number there as well. So children and youth can call them and speak to somebody instantly, pretty much. And actually, kind of I got a bit of a story here. When I was in elementary school, probably about grade 7 or 8, my friends and we would sometimes get together and prank call the Kids Help Phone line. And just looking back on that, I just feel terrible. Like, I feel awful that I did that, because like, you have a service here that's meant to help kids, and here I am, you know, just being a jackass and just wasting their time. It just makes me feel sick, honestly, knowing that I did that. And I think I almost want to apologize to them for what I did, because it's just really it's really important that kids get help, and it's really important that the people working there can help as many people as possible who are struggling. Um, there's also the crisis text line. So that is somebody, again, it's 24/7. You can text that number and you can talk to somebody instantly over text if you're experiencing problems with depression or anxiety or just anything, bullying, um, and then now I'm going to talk about support groups. So with support groups, there's several different support groups for various kinds of mental illness. But the important thing to know is that having a mental illness can be a very isolating experience. So support groups are really good to really just bring people together and help them support each other and not feel so isolated. If you want to learn more about support groups in your area, I recommend calling SHA or just doing some internet research. There's quite a few out there, honestly, and I'm sure that if you are somebody who's struggling, like even over Zoom, like even in these times of COVID over Zoom, there's still support groups going on. So that's really important. Okay, so we've come to the end of our presentation here. We just have a survey. There's only about, I think, 5 or 6 questions on it. We would really appreciate it if you guys took the time to do the survey. Um, it would really help us because it would really help us because feedback is actually a part of this assignment for us. So and just in general, hopefully it would help you or somebody else if you know that are struggling with a mental health issue as well. So I just like to reiterate that it's really important to reach out if you know somebody, and chances are you do know somebody who's in need of help. So it's just really important to talk to somebody, and I hope this presentation has helped. Here's just our references. We used a lot of references, a lot of information.